In this video, we are diving into tuberculosis, commonly known as TB. TB is a contagious and potentially severe infectious disease caused by the bacterium Mycobacterium tuberculosis. TB primarily affects the lungs but can also impact other organs. It spreads through airborne droplets when an infected person coughs, sneezes, or talks. Despite global efforts to control it, TB remains a major health problem, particularly in low and middle-income countries. According to WHO, TB is one of the top 10 causes of death worldwide and the leading cause from a single infectious agent, ranking above HIV or AIDS. Next, we will explore the importance of MNT in tuberculosis. Firstly, enhancing immune function. Adequate nutrition strengthens the immune system, aiding in the body's ability to fight TB infection more effectively. Nutrients such as proteins, vitamins, and minerals play critical roles in immune response. Secondly, preventing and managing malnutrition. TB patients are highly susceptible to malnutrition due to factors like reduced appetite, increased metabolic demands, and side effects of medications. Malnutrition can further impair the immune system, leading to a detrimental cycle that obstructs recovery. Thirdly, supporting medication efficacy and compliance. TB treatment involves long-term use of antibiotics, which can cause side effects like nausea, vomiting, and loss of appetite. Proper nutrition can help mitigate these side effects, making it easier for patients to adhere to their medication regimens. Lastly, reducing complication and improving quality of life. Well-nourished patients are less likely to experience severe complications and have better overall health outcomes. Good nutrition can improve energy levels, reduce the risk of co-infections, and enhance the overall quality of life for TB patients. Now, let's delve into the pathophysiology of TB, which involves 3 stages: primary infection, latent infection, and active infection. For primary infection, TB is primarily spread through airborne particles when an infected person coughs, sneezes, talks, or sings. Inhalation of these particles can lead to infection. Once inhaled, Mycobacterium tuberculosis bacteria reach the alveoli of the lungs. To initiate infection, Mycobacterium tuberculosis bacilli must be ingested by alveolar macrophages. Bacilli that are not killed by the macrophages actually replicate inside them, ultimately killing the host macrophage with the help of CD8 lymphocytes. In the early weeks of infection, some infected macrophages migrate to regional lymph nodes where they access the bloodstream. Organisms may then spread hematogenously to any part of the body. Next, latent TB infection occurs after most primary infections. In about 95% of cases, after about 3 weeks of uninhibited growth, the immune system suppresses bacillary replication, usually before symptoms or signs develop. Foci of bacilli in the lung or other sites resolve into epithelial cell granulomas, which may have cases and necrotic centers. Infectious foci may leave fibronodular scars in the apices of one or both lung, or small areas of consolidation. The tuberculin skin test and interferon gamma release blood assays become positive during the latent stage of infection. Healthy people who are infected with tuberculosis have about a 5 to 10% lifetime risk of developing active disease, although the percentage varies significantly by age and other risk factors. If the immune system becomes weakened due to factors like HIV infection, diabetes, malnutrition, or immunosuppressive drugs, latent TB can reactivate, leading to active TB disease. Active TB is characterized by the breakdown of granulomas, allowing the bacteria to spread and cause tissue damage. This can lead to cavitation in the lungs, where large cavities form due to tissue destruction. Active TB typically presents with chronic cough, hemoptysis, which is coughing up blood, chest pain, fever, night sweats, weight loss, and fatigue. Now, we will explore medical nutrition therapy for TB. Nutritional implications such as malnutrition, muscle wasting, and weight loss commonly happen among TB patients. Thus, nutritional intervention in combination with appropriate medications may be necessary to improve the health outcomes in TB patients. The goals of MNT in TB is to improve quality of life and reduce the length of hospitalization, accelerate the healing process of the disease by improving the immune system, and improve nutritional status by improving appetite and food intake. Since malnutrition increases TB disease risk of reactivation, aiming for weight gain and muscle mass may decrease the susceptibility to infection. The current energy requirement for the undernourished and catabolic patients is about 35 to 40 kcal per kilogram of ideal body weight. Meanwhile, patients with concomitant infections such as HIV may need to increase their energy requirement by 20% to 30% to maintain body weight. A protein requirement of 1.2 to 1.5 gram per kilogram ideal body weight, or at least 15% of total energy intake, is essential to prevent muscle catabolism. Micronutrient deficiencies such as vitamin D, magnesium, and selenium are commonly associated with poor nutritional intake among TB patients. Thus, the diet recommended for carbohydrates is 45 to 65% of total energy intake and should mainly derive from cereals, whole grains, root and tubers, and also vegetables. For protein, the intake should comprise around 15 to 30% of the total energy intake. A higher protein intake, especially with higher biological values, is important to prevent muscle wasting. Furthermore, fat should comprise 25 to 35% of total daily energy intake. The addition of oil, ghee, and nuts to the diet can help achieve the goals of energy intake since fats are calorie dense. Micronutrients such as vitamins A, C, D, E, B6, folic acid, and the minerals zinc, copper, selenium, and iron are essential for metabolic processes, cellular activities, and immune function. There are a few strategies in achieving the requirements in TB patients. Firstly, it is encouraged to consume a well-balanced diet with small and frequent meals divided throughout the day. Besides, it is also advisable to avoid tobacco and alcohol consumption. Consuming at least 500 to 750 ml of milk or yogurt daily is recommended to ensure sufficient intake of vitamin D and calcium. Encourage meals that are visually appealing, flavorful, and rich in protein and energy to increase the patient's appetite. And lastly, increase fruit and vegetable intake, which are 3 serving vegetables and 2 servings fruit per day. It is recommended to consume whole fruit rather than fruit juice. Remember, good nutrition is key to battling TB and maintaining overall health.